So talk to us about dosing. Talk to us about what's too high, what's not too high. How does your lay person know?
Yeah. So I think this is like a very simple idea, is that we use the dose that treats your symptoms while minimizing side effects. And we do that using FDA approved, well-studied formulations and dosing options, right? So meaning that we don't have to stick to the lowest dose. No, we've got all of these different doses approved by the FDA specifically because it must be individualized, right? Now, so when is a dose too high? Well, a dose would be technically too high if a practitioner was not practicing evidence-based medicine and was giving you very, very high doses that are, not, recommended. But we have a wide range of formulations. And if, we can talk about, for instance, a patch comes in 5 different dose options, right? So, when a woman comes in, as a new patient, we're going to look at her whole picture. We're going to look at her age. We're going to look at her symptoms. We're going to look at how far she was from her last period. And then we're going to make a recommendation. And that's the art of medicine, right?
Right.
Now and then when someone has too high of a dose, they'll probably have side effects, right? So that gets back to this kind of general principle: treat the symptoms, minimize side effects. So, I always tell patients, how do we know what is the right dose? They ask, well, should we be checking blood levels, which I know we're going to get to, but this kind of touches on that. No, I'm not going to follow you based on your blood levels. I'm going to follow you based on your response. Because I can tell you, you can see women who are on the lowest dose patch and they feel great.
Yeah.
And I have patients who are on the higher dose of the patch, for instance, and they feel great. And they're both a similar age with a similar medical background. And patients, I want everyone to know that your dose is just one part of how you feel, because remember, that dose has to be, and that formulation has to be either absorbed through your skin, or if you're taking it orally, it's got to get metabolized, it's got to get to your receptor, and then our receptors are all going to respond to that hormone in a different way. Some of our receptors need a little bit more, some need a little bit less. This is very individualized, and there's no one lab test that can tell you that. So we just listen to your body and your symptoms.